Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan and today we're going to discuss the acute visual loss. Now whenever we say an acute vision loss, it's basically referring to the visual dysfunctioning within 24 hours. Usually we divide these visual loss into acute, subchronic and then the chronic causative factors of the visual loss, and over here in this lecture we'll be just focusing on the acute causes of the vision loss. We can further subdivide this acute vision loss into the categories of painful and then we have the painless vision loss. This is going to help us in the differential diagnosis of the vision loss. So over here in this very first section, we'll be discussing the causative factors. So knowing the causative factors of the acute visual loss or the changes that can basically lead to the vision loss, that is basically the loss of the clarity to see or the loss of the clarity of an ability to see properly, we should know the anatomical structures of the eye. Knowing the anatomical structures and understanding the anatomical structures that can basically hinder the clarity of the vision is again very important over here. So we'll be discussing the anatomical features of the eye, of the orbit over here, and then we'll be moving on to the history and obviously the scientists who worked forward to know the causative factors of the acute vision loss. We'll be discussing them over here. And then we'll be moving on to the causative factors of the vision loss or the acute kind of a vision loss. We'll be discussing them over here in this very first section. In the second section, we'll be discussing the history. So the historical findings are again very important. The research work that has basically laid the foundation towards knowing the anatomical structures of the eye in a more concise manner, and then basically highlighting the features that can basically lead to the acute vision loss that will be discussed over here in this very second section. And then we'll be moving on to the relevance, just to know why you should know about the acute vision loss, about the causative factors of the acute vision loss. Why is it so relevant to a physician who's working out there? So we'll be discussing that over here, and then the basic information. So history taking is again very important when you have a patient of acute vision loss at your hand, and we'll be discussing what is the basic information that you have to get from your patient just to make a nice differential diagnosis, and then work on that differential diagnosis to get a definitive diagnosis over here. In the third section, we'll be discussing the acute unilateral vision loss particularly. So basically the causative factors are going to differ when we talk about a unilateral vision loss, and it's going to differ from a bilateral vision loss. Over here in this third section, we'll be discussing the fundoscopic findings. When you're done with the history taking and you have started off with the examination of the eye, what are the particular fundoscopic findings that can give you a clue towards the causative factors of that unilateral vision loss, and then the examination. The complete eye examination, which can lead to making a differential in case you get a patient who presents to you with acute vision loss. That will be discussed over here. And then the treatment guidelines that are usually the treatment modalities according to obviously the causative factors and according to the history of the patient. That will be discussed over here. In the fourth section, we'll move on to the acute optic neuropathies. So the diagnosis, first of all, it's also known as the AION. So what is the diagnosis of this acute optic neuropathies? We can basically subdivide them, and then there are subcategories relating to this acute optic neuropathy. We'll be discussing the diagnosis over here. We'll be discussing the differential diagnosis that will again highlight the causative factors of this acute optic neuropathy over there. And then finally, we'll be discussing the optic neuritis. So optic neuritis is, it can be of the inflammatory kind, and then we have the other causes of the optic neuritis. We'll be discussing all of these causes over here in this fourth section. In the fifth section, we'll be discussing the anterior ischemic optic neuropathy. So this is again very important. It's again one of the causes of the painless and sudden loss of the vision. The arteritic AION that will be discussed over here. Then we have another kind which is known as the non-arteritic AION. And then we have another very important cause which can lead to a sudden loss of vision, which is again painless over here. So we'll be discussing that over here. So I hope you want to learn more about this acute visual loss. So do watch the other sections to this lecture as well.